One of the questions that I had was whether or not someone with severe childhood trauma could also have an attention deficit disorder. This person had never been formally diagnosed, but they do know they had some early childhood traumatic experiences. Being a developmental disorder, an attention deficit needs to be present before the age of 12, but if it's also comorbid with severe trauma, then when I typically assess someone, I'm really looking heavily at that portion. I tend to go with the thing of that's least stigmatizing, and as crazy as it sounds, trauma relative to a developmental disorder in a way can be less stigmatizing, because once you take on this idea that you have like frontal lobe dysfunction, that kind of sticks with you for the rest of your life. Trauma, on the other hand, can kind of be treated slowly and surely as you kind of redevelop your identity over time and identify the behaviors that were the result of trauma and hopefully discontinue those. But when you're a child, your brain is really growing, it's really developing, so it's really susceptible to not only what's going on around it, but also whatever it was organically wired with. And if you're not in a stable environment, and if you're receiving a lot of abuse, which is essentially anything that the body is not capable of processing adequately, then it can really disrupt those attentional circuits, all right? Now, they've done studies, and they show that individuals with trauma, they are particularly inattentive in the face of emotional stimuli. There's a couple of little assessments I do. One of them is called the Stroop task, and this really activates the limbic system real well. And you kind of look at their performance on that to get an idea, is this a subcortical issue, which is kind of deeper in the brain, or is this a cortical issue, kind of a little bit higher up in the brain? All right, because you can have problems with attention on both levels. All right, there's simple and complex attentional problems. There's problems with switching between tasks. There's problems with staying on task. There's problems with getting on task. I mean, there's tons of problems with attention. You know, the thing about attention is that it is kind of like the gateway to everything. If you can capture someone's attention, then you're capturing a lot, you know, especially in this limbic system economy. Everybody is looking to get your attention. So when you couple a lot of modern technology on top of maybe childhood trauma, which has already disrupted those circuits, on top of maybe comorbid ADHD, I mean, you can really have a cacophony of trouble here. So my advice to that person would be probably to go with treating the trauma, probably limit their screen time, learn to engage in some emotional control, maybe seek out EMDR or brain spotting or mindfulness-based treatments. Start there, because a lot of those things will also treat ADHD. So start there, start with the least thing first, and then go to more complex things.